Welcome to the Mike and Alison After Hours podcast with your hosts, Mike Sheila and Alison Haas, talking business with real business owners in the Mid-Atlantic region. Today's episode is sponsored by Advantage Industries. When you need business technology, get Advantage Industries to protect and promote your business. To learn more, go to www.getadvantage.com and schedule your first meeting to see if you qualify for a free network scan.
Hello, everybody, and welcome to Mike and Alison After Hours. I am your host, Mike Sheila, and with me today, my co-host, the always sincere and often supercalifragilisticexpialidocious Alison Haas. Alison, how the heck are you today?
I was like, oh, I don't need a dictionary today. We're gonna make it. I'm good, Mike. It's great to see you and be here.
Yeah, so for our listening and viewing audience, a couple of cool things. One, our podcast is officially over 1,000 views and downloads. And on the one hand, that doesn't sound terribly mighty, but for us, we're a podcast that this will be our 20th episode that we are recording. The fact that we have reached that milestone, we just have to say thank you so much to everybody that has been watching and everybody that has been listening. And it's a very interesting balance. It's almost a perfect 50-50 split. Half of it is from viewing us on the YouTube channel, and the other half is from listening to us on basically any podcast platform that you like.
I love it.
So if you're new to the show, we are on iTunes. We are on Podbean. We are on Stitcher. We are on Amazon Alexa. We are on Spotify. We are on Pandora, Audible. You name it, you can find us. You just have to look up Mike and Alison After Hours. And because of that, the last few episodes, you have heard us talking about our good friend Andrew Friedman. He was a guest several episodes back. He is one of the principal owners of a company in Baltimore, and he recently published a book called Thrive. One of my college buddies and also my fraternity brother, Greg Cangelosi, had Andrew on one of his shows that I got to watch yesterday. And Forbes magazine is recommending Andrew's book as one of the top to read in 2021. So
damn, go Andrew.
Impressive. So for our listening audience, you have a chance to win an autographed copy of Thrive from Andrew. So super cool. We want you to comment on the show, whether that's on YouTube or any various podcast platform, or if you see Alison and I posted on LinkedIn or Facebook or Twitter, I tweet. Alison is not a tweeter.
I do not tweet.
But if you see it on any of those platforms, drop a comment, drop a like, share it, because we are paying attention. We are watching, ladies and gentlemen, and we are going to pick someone to not only get a signed copy of Andrew's book, but we are also, for a business owner that has at least 10 employees, Andrew has graciously offered us a 1-hour training session with your team. Super cool. We will be announcing those in June. So just a few short weeks away. Again, exceptionally grateful for everybody that's been tuning in, watching, and listening. And today's guest, really cool. We're going out of our way to make things different. We're trying to have diversity. We've had a lot of tremendous, strong female leaders on the show recently. And we've had large organizations, we've had small organizations, and everything in between. We're now going into the medical field. We're going to have on Dr. Michael Kerins today, and he is the owner of Magothy Dental in Glen Burnie, Maryland. So this is going to be super exciting because we're going to see the differences and we're going to see the similarities. Right, Alison?
Yes. And he's just getting started, more or less. So I think it's really great for our audience to hear what it's like from the trenches, right? Because a lot of our guests have been doing it for a while. And while it's certainly not a strict linear line, it's nice to hear, like, what is it like now while you're doing this, getting started, not knowing that that was what you were going to do when you got older.
From the trenches in the middle of COVID, right?
Yeah.
So yes,
and
here's one of the hardest things in the world to do: start a business. And by the way, we're gonna throw this COVID thing on your plate too, and then half your staff's gonna leave. But we'll let Dr. Mike get into all that when we get into the show. So that's going to be great, and he'll be coming on in just a few minutes. So Alison, how are you?
I am great, right? we do our little pre-show debrief, like, what do you want to talk about? And I'm like, not work. And so it was, the first quarter just ended. So depending on your business, that may mean a lot, that may mean nothing. It means something to us just because it's really sucky to have to get it all done at the end of the year, right? But sometimes that's just kind of how the cards fall. And so I proclaimed that I didn't have a great first quarter. And yesterday, my boss and I were talking, and she knows me. I am also me wherever I go. So I'm not afraid to be like, hey, I feel like a loser today. How are you? Right. And she talked to me, and I have it up on my other screen, about the Dunning-Kruger effect.
Ooh, now I have heard this term before, but I profess I do not thoroughly understand it. So please educate us, Miss.
So I had not heard of it, nor did I know. And so if you Google, Google Danny Kruger, that's not it. It is Dunning-Kruger. And you'll see these graphics. And basically, it's talking about your competence and your confidence on the X and Y axis.
Oh,
and so
interesting.
It applies to the life of a salesperson, right? A business owner, your personal endeavors. And so in the beginning, you know nothing, and you have no confidence because you know nothing. Fine, right? Just throw me to the wolves. And then as you learn a little bit, this is funny, you get to the top of your confidence and it says peak of Mount Stupid, right? So you're really confident because you have this new job and you're excited about this opportunity, but you still have no idea what you're talking about, but you feel great about it. So you just don't care, and you're just blasting through doors because you haven't heard no yet, right? You don't know any better. Then you hear some no's and you start to come to fruition with reality, and that this might suck for a little bit, plummet down to the valley of despair, right? And then and I'm following the graphic here, you slowly get competent through experience, right? Practice, studying, on the job skills, reading. The slope of enlightenment is what they're calling this. And then you get to a plateau of sustainability where you both are a guru in your competence and in your confidence. And so I am not quite at the valley of despair, but I'm on my way back up because there's just such a steep learning curve in anything, truly. And last year was hard. Last year was a hard year. I don't have to tell you why. We all know why, but it just felt like there was an additional few layers of yuck. And I had to recalibrate. I had to reprocess. And I am resilient. I am a diligent hard worker, but that seemed to carry into first quarter, and it shows up in my energy, right? And so I noticed I was typing more than I was picking up the phone, which as a salesperson, there's no one way to prospect or get in front of someone or connect with someone, but the truth is that you have to do everything, and at some point everything works. And that includes picking up the phone, right? And so, COVID's had an interesting effect on me personally, because I've got this like Gucci schedule where I work at home, and you don't know that I just worked out because I have a nice top on, but and then on the other side, it's like, I miss the engagement, more interaction, right? And that purposeful show up in somebody's office with my suit on, shake hands, sit at a nice conference table and feel important, as opposed to like, I hope they show up on camera today so I don't talk into a black hole on the other side of the screen, right? So that's how I'm doing, Mike.
Well, I want to extrapolate. There's my 50-cent word of the day.
I like it.
Your Dunning-Kruger explanation, which I thought was brilliant. I loved it. Thank you. To something that I have dealt with in sales my entire career. And most salespeople that are listening to this can probably appreciate this. You're prospecting. You book a bunch of appointments. You're running appointments. You're doing follow-up appointments. You're closing sales. And then you go, well, crap, I don't have any more appointments to run because everything that I worked so hard on to book a few weeks ago, I've worked through it. So now I have nothing to do. So what do? Oh, I'm going to book appointments all week. So you work and it's this awful up and down, up and down. I'd like to say that I've gotten marginally better at it over the years, and that's probably somewhat true. But and Alison, I related this to you. I don't think I related it to the audience. That about a decade ago, I was in a car accident and I got a concussion, and it interfered with my vision. Long story short, I have a funky eyeball, and my brain before the concussion would take the fuzzy picture from the one eyeball and the clear picture from the other, would put it together, and I could read and I could see and I could do all that. After the concussion, my brain said, nope, not doing it anymore.
Yeah.
And I would get these horrible migraine-like headaches. So I went to a therapist and they gave me exercises and I worked through it and I got better, and I was better for the last 9.5 years. And then right after Thanksgiving this year, because as you said, we don't go out to see people anymore. We stare at our computers 8 to 10 hours a day sometimes.
Thank you, blue screen glasses.
Yep, my new ones are coming in the mail on Saturday. I'm so excited. But because of that, I pushed myself too hard and the headaches came roaring back.
Yeah.
And the doctor couldn't see me for over 2 months.
Mm.
So the only thing I could do was not stare at the screen. And as a result, my funnel just went into the tank.
Yep.
And as a result, my month of January, from a prospecting standpoint, was awful.
Yeah.
Now, I finally got myself back together and saw the doctor and started doing some exercises for my eyeballs, and I'm back on track. And I finished the quarter very strong from a prospecting standpoint. So, but now I have that problem again. I have all these opportunities that I'm trying to move through the process, and it doesn't leave me enough time to effectively prospect.
Yeah.
So I'm going through that. I'm on that roller coaster ride again.
Yeah.
And Alison and I relate this for a couple of reasons. One, if you're a salesperson, you're probably shaking your fist going, right on, my brother and sister. I'm with you. I know what that's like. And for you business owners, you're like, really? Is that what it happens? I had no idea. Yeah, I think I've shared this before, that I often speak with the president of our company and he'll ask me a sales-based question. And I'll say, well, everybody does it this way. You know, this is a pretty standard sales procedure. And he'll look at me and say, Mike, I've never worked for another company. I have no idea how other companies do it. He's been an entrepreneur literally since he got out of college. And I have to keep that in mind when I'm talking to our audience, when I'm talking to him, when I'm talking to a business owner, that they don't always understand the perspective that we are coming from.
Yeah.
And you touched on something, Alison. Part of what makes a salesperson is the thrill of the kill.
Yes.
Yeah, we like making commission checks. We absolutely do. But it's the satisfaction that we got it across the finish line. We got ink to paper. This is in ops hands. They're now working it through the ops system.
Yeah.
That is, for lack of a better term, it's intoxicating. It's an endorphin.
Oh yeah, you get high. It's a total, like, I forget what happened all 5 months prior to now, and it's just like, ah!
And if I circle this back to one of our favorite themes, which is emotional intelligence, is in Emotional Intelligence 2.0, they tell you, don't let yourself get too high and don't let yourself get too low, because the goods are never as good as they feel and the bads are never as bad as they feel.
Nope.
And that's, the more you can keep that perspective, keep that level head, the more effective you can be in whatever your role is within the organization. Go ahead.
I agree. And I have two things I'm thinking about. One is the prospecting up and down. It's not, you don't notice it for a little while, right? Like I know for me in the beginning, before I figured out a balance, like, so once I got all my, in the beginning, you're just prospecting, trying to fill your funnel with prospects, and then you get meetings. But then when you start building proposals and then having the meeting after the meeting and then a demo and then the proposal and then the 50 tweaks that you need with the 50 meetings after the proposal to actually close it. How do you keep prospecting, right? Because people don't just, I would love if people came to me. So anyone listening, feel free to send me an email, right? But it's like, you have to keep prospecting. That is part of my day job, prospecting every single day. And if I let off that gas pedal on prospecting at any given point, I'm not going to feel it that month. I'm going to feel it 2 or 3 months later. Yeah. And so for those people listening, I'm not saying don't take a week off, right? I'm a huge advocate of PTO, as we know. But you've got to figure out a strategy where you can continue that part every day, no matter what. Even if one day you are just emailing just to get it out there and say, you know what, I checked my box, I hit 50 people today, tomorrow I'll call them, whatever. But the other thing is I'm reading Virtual Selling right now by Jeb Blount.
Oh, very nice. Jeb Blount, one of my favorites.
And he keeps saying how in-person meetings are still important. And I'm like, I don't want to commute anymore, Jeb, stop saying that. And of course, I'll get in my car and drive again, but this is nice. So, but he's talking about keeping our emotions in check and the ability as salespeople to handle ourselves emotionally. And it goes through like what you just said, not attaching to being wherever you are, high or low, because it's going to change. It's going to change. And so I think you and I do a great job. I'm going to toot our horns as friends I think part of the reason we are able to keep going is because we share where we're at with each other, right? Yep. I don't pretend that things are better than they are, and I don't make them worse than they are. We also have lives. So there are things that give perspective, right? Like, okay, that prospect said no, but mom's doing all right today, right? Or whatever. So those were the things that I was thinking about while you were sharing.
Yeah, and I love what you brought in there. You and I had a great conversation yesterday about a prospective client that you're working on. Yep. And you reached out to me to ask me my opinion. And at first I was like, well, gee, I don't know. But as we started talking, like the floodgates opened. I'm like, oh, great. I've been verbally vomiting on Alison now for 15 minutes. But you were like, no, I caught some good things in between all the vomit.
Yep. Notes.
And I think that's another thing that a lot of, we talked about this a little bit before on the show, that a lot of sales professionals and certainly a lot of business owners don't do. They don't look to peers. They don't say, well, how do I do this?
Yep.
And getting that second perspective is perhaps the most significant factor in success in my mind. You know, yep. I talk about my engineer, Russell, all the time. He is on almost every call with me. And there are plenty of times where I don't actually need him, quote unquote. There are plenty of non-technical conversations that I have with clients, but Russell tends to pick up on things that I miss.
I love that.
And I pick up on things that he doesn't typically see.
Yep.
Then when you're talking about what we do, and I'm going to say that very generically, because you brought up another point around the sales cycle. Unless you are buying a pen, there is no such thing as a transactional sale. Most of the people that are listening here today, whatever it is that you provide is a relationship sale. Now, that does not mean that you become best friends with every customer, but it does mean that when a customer comes to you, and I've used this analogy before, you know, I need a nail. Okay, well, what are you building? Well, it doesn't matter. Well, it absolutely matters. Because you can buy a nail anywhere. You don't need me to buy a nail.
Yep.
What you really need me for is to help you understand how the nail is going to benefit you.
Yeah.
And maybe a nail is the worst thing you could buy right now.
Yeah.
So with that 90-day lag between prospecting and sales, I think that's about right and again, I've been at this 20 years now. You've been at it for a decade. There are times where you get lucky, right? Right place, right time.
Yeah.
You meet, and one of my biggest deals that I sold in my career, I closed it in just under 30 days, around Christmas, no less.
It's amazing.
Traditionally the worst time of year to try and sell something.
Right.
And it was a $10,000 a month account. And I ended up growing that account to $22,000 a month.
Beautiful.
But that's the exception.
Yeah.
And I think a lot of people go, well, look what Mike did.
Yep.
Mike got lucky.
Yeah.
Mike was in the right place at the right time, and he had the right solution.
Yep.
Beyond the other 95% of our sales, you have to take time. We've been, my company, Advantage Industries, we've been working very hard to improve our marketing strategy and improve our website and improve our inbound leads. And there's a double-edged sword to inbound leads because these people don't know you.
Right.
One of the things that Alison and I leverage the heck out of is we introduce each other to people that we already know.
Yeah.
I'm working on a deal that Alison introduced me to, and I'm fingers crossed I'm going to sign him up this week or next week. But that helped with the sales process, but it's no guarantee.
No.
It's even still, around a 90-day process.
Yeah.
And sometimes it goes longer, and sometimes you have to be okay with that.
Yep. And I want to leverage your bringing into the peer-to-peer collaboration. I think especially because most of us are not engaged face-to-face right now. We're not in the office. I know my team is comprised of a lot of newer folks, and part of the office culture is being able to hear people talk on the phone and hear what they say, right? How do they combat objections? How do they talk to someone when they actually answer the phone? And you're like, wait, I was ready for a voicemail. Can you hang up? And I'm going to I don't know what to say to you right now. And just listening. And so I think that collaboration is, for me, sacred right now, because it also brings me into like a workforce where I'm not just here in my basement office by myself all the time. And like you yesterday, you just started talking and it was like things I know, but like to hear from you as a refresher and a reminder, like that's why I called. And to think that
they hadn't come to mind. Yeah, you needed a primer.
Yeah. And like to think that I know everything all the time is only going to stunt my professional success and growth, right? I really don't want to think I know everything. And I can say this happened to me at the beginning of last year. I had a super year. I made trip and I got a little cocky and I'm like, I got it. I'm good. And then I hit a slump and I realized I had to ask for help again and get refreshers. And then things started to come up again. And I think, even though I didn't have the year I wanted last year, I made trip again. And so maybe a similar thing was happening. I'm going to admit it right now on this podcast live with you folks, right? And so I've had to ask for help again. And just hearing how people say things is so useful. And just you pick up one or two words to add to your verbiage, you get a fresh set of eyes. I can't obviously speak highly enough for peer-to-peer collaboration. And I know there's a lot of like CEO mind groups, right? I can't think of like actual names right now, but where I know a lot of my clients, they have their CEO peer groups where they talk about things. I think my
president's in 3 of them now.
Yeah. And I think that's amazing, right? Like you're not the only one dealing with this stuff. So learn how someone's doing it and you swap advice back and forth. I think it's an awesome tool.
So I started a new book this week, and I'll give you a little more context on it after I'm going to do a magic trick with you, Alison.
Oh,
this is either going to go awesome and everybody's going to be stunned, or it's going to fall flat on its face. But either way, I'll explain.
Judgment.
All right. So first thing, Alison, I want you to think of a lucky dwarf. A lucky dwarf. Don't overthink it. Just think of a lucky dwarf. Now, the next thing, I want you to think, put in your mind the first number that pops into your head between the numbers 1 and 10. First number that pops in your mind, just put it in your head between 1 and 10. You got it? You're number 7.
What? I am. How the hell did you know that? So what does the dwarf have to do with it? By the way, I'm like, I hope he doesn't ask me the name of the dwarf because I don't know, but I can see it. I don't know what their name is, though.
So I found this fascinating book on influencing others. And
what's it called?
I will put it in the show notes. The name is escaping me at the moment.
Okay.
But
I'm trying to write it down.
What I just did was I primed you. So think about the two words I asked you.
Lucky dwarf.
Okay. How does 7 relate to the word lucky?
Lucky 7. How?
Dwarf relate to the number 7. Snow White and the 7 Dwarfs.
Oh, duh. I was envisioning one of them.
So here's the funny part. You didn't come up with that when I asked you consciously, but subconsciously, your brain has a neural connection to those.
Sure.
So when
Childhood.
you are doing high-end expensive advertising, they put lots of primers into them. It's a fascinating read. One of the things that the book recommended is if you are talking to a customer that is resistant, their arms are crossed and they kind of give you the stink face, you want to use the word flexible a lot. Because the word flexible subconsciously prompts us to be more open-minded.
Oh, I love this. I got to get the title. This is great.
Hang on a second. I will pull it up on my Google machine from Amazon.
I got 3 books written down already just from this morning.
Yeah. So I don't think I told you this, but I ordered a book on cold reading. Which if you're not familiar with the term, cold reading is how psychics appear psychic. And this book
is my next career opportunity, Mike.
What's that?
Is this my next career opportunity?
Yeah. The book is called Methods of Persuasion by Nick Kolenda.
Okay, I like it.
So I've always been fascinated by cold reading, and why do people flock to psychics? Because you'd think, in principle, the big joke is, well, gee, if you're a psychic, you know I was coming, and it doesn't really work that way. So this man that wrote this book, he said, I've been a psychic entertainer for 20 years, and I'm here to tell you it's all BS, and this is how I do it. And it's fascinating. When you read through it, all of it totally makes sense as to how they get people to think, wow, this guy just read my mind. And you're familiar with Penn and Teller, I'm sure. Magicians and comedians. Penn is 8 feet tall and glasses and a ponytail, and Teller is 4 feet tall and never speaks. They have a TV show. They are magicians. They are comedians. But they were there when they come out on stage. The first thing they tell you is, we are scam artists. We are going to lie to you, and we are going to BS you. In fact, they had a show on Showtime for several years called BS.
Oh, I love it.
And it talks about how there are so many just things in life that we sort of take at face value.
Yeah.
And we don't necessarily go deep in on them. And that's why most people don't like dealing with sales. Because they're like, this guy's going to manipulate me. He's going to use some Jedi mind trick on me, and he's going to make me do what he wants. And, some of them are, frankly, very good at that. So on that note, Alison, our guest is here. Welcome to Mike and Alison After Hours. How are you, my friend?
I'm well. How are you?
Doing awesome. We've been having a super entertaining session right before you joined us, to say the least. So everybody, I want to tell you, Dr. Mike Kerins, he is the owner of Magothy Dental, which was formerly Howard Katz DDS and Associates. It's a full-service dental practice serving Pasadena and Severna Park. We have been trusted by Maryland families for over 60 years with routine dental services as well as sedated procedures. Our modern yet personable approach means quality dental care doesn't have to be scary. And they are currently accepting new patients.
That's right.
Dr. Mike, awesome to have you on the show. You are a first for us. You are our first medical professional. So that's super cool. Alison and I were just talking about, we're trying to go through a lot of diversity with our guests on the show because, and boy, do you have some interesting stories to tell us. You bought a business and then COVID smacks you in the face and like half your staff just like up and left.
Right.
So certainly can't wait to hear your story. So what we're going to do is Alison's going to take you through who, what, where, when, why, how, which is just your chance to tell us your story. And then I'm going to wrap up with some of your thoughts on leadership, how you've been thrust into leadership the last 12 months, and then, some of the lessons that you've learned to run your business and be successful.
Okay. Sounds good.
Awesome. Alison, take it away.
Well, thank you, Mike. Good morning, Mike.
Good morning.
And thanks for joining us. So this part is really for you to steer however you want the audience to be steered. So can be all professional, can be a blend of personal, professional, how you ended up as a dentist and owning your own practice. But what would you like us to know about you and who you are?
Well, first, let me say that I'm honored to be a part of your achieving diversity. I don't think I've ever, as a white male, been considered a diverse piece of anything. So that's cool. I don't know. I guess, like Mike said, I'm a dentist. I recently bought a practice. I had been working at that practice for about 2.5 years before I bought it from the previous owner. And it was also just really serendipitous timing. The sale was being worked on for a while. It took a while from when I first engaged with a letter of intent to when the sale was complete. But once the sale was complete, it was probably like a month after that COVID started. So it was an interesting time to become the head of a business. But that's kind of, I guess, my summary.
So back us up a little bit. So obviously there's a lot of education involved in becoming a dentist. So, where did you go to school? Is that something that was in your trajectory for the entirety of your high school? Like, did you know you were going to be a dentist and go to dental school and ultimately get a practice?
So I don't have any kind of like profound story as to why I wanted to become a dentist. It's not something that I was even considering when I was younger. I think I really wanted to be a veterinarian for a while.
Me too.
Like when I was, I guess, in high school. But I went to college and I was studying biology just because I really like biology. And it wasn't until maybe like halfway through college that I was like, what am I going to do with a degree in biology? And so I considered my options. I knew I didn't want to teach. Both my parents are teachers, and it's just not something that was appealing to me. And healthcare always seemed really interesting. So I just kind of explored my options, and I went and I shadowed a couple doctors, I shadowed a couple dentists, and dentistry just seemed like something that I could do. I could see myself doing long term and not hating my life. So
Good goals.
so I just kind of pursued it from there. And yes, it was a lot of education. I had to go to college, and it was some extra work in college just to be able to apply to dental school. And then I went to dental school because I made my decision kind of late. I applied a little bit late too. So the application cycle that I entered into I wasn't going to be able to start dental school until a year out of college. So I had this kind of year in between where it was weird. Like, I graduated college, my application was in to dental school, but I didn't know whether or not I was going to be accepted.
Oh, wow.
And so I started taking classes at another school basically so that in the event that I didn't get accepted, I could still show that like my intention was to go to dental school. My intention was to improve my academic standing from where it was before, and that I was going to reapply again in the future if need be. And so luckily I didn't need to reapply. I got accepted, and I live in Maryland, and I got accepted to the University of Maryland Dental School. And I knew I wanted to go wherever tuition was cheapest, because it's really expensive and you end up with a lot of debt no matter where you go. So I wanted to get that in-state tuition. So I went to dental school, put in my 4 years there, and when you finish dental school, it's not like medical school, where if you go to medical school, you don't graduate medical school and just like go to work as a doctor. You have to go to some kind of residency where you specialize or put in some time. Kind of, it's like an apprenticeship essentially.
Sure.
And so but that's the route that you go if you're a medical doctor. With dental school, it's a little different. You could graduate dental school and go to work immediately. You could open your own practice immediately if you wanted to. But I was not that confident. And I knew that I needed to get some more experience under my belt beyond what I had developed in dental school before I was ready to be out there and have the buck stop with me. So I did a residency. It was a clinical fellowship, and it was at one of the VA hospitals in Maryland. And it was, the cool thing about doing a residency at the VA is you don't have to worry about money being, most of the time, you don't have to worry about money being an issue for the people that you're treating, because if they're getting care at the VA, then they have that benefit, and so the VA is providing their care for them. So if you present someone with a treatment plan and say, I think that this is the best option for you, then as long as they believe in what you're presenting, then they can take it and they don't have to worry about money. So that was a cool thing about the VA. And that particular residency also got me a lot of exposure to oral medicine, because it had a component where I was also spending time in the oral medicine clinic at the University of Maryland. And that was cool because I got to see like a lot of really weird oral diseases that you don't get to see very often, just out in private practice. It was that clinic was basically where all of the private practitioners send people when they see something that they have no idea what it is or no idea how to treat it. And so I got a lot of cool experience there. And then after I finished my residency, I went to work as an associate dentist, which is you're just working for someone else in their private practice. And so I spent time doing that at a few different places. And my intention was I wanted to work at a couple different places part-time simultaneously. So I would spend like part of my week in one practice and part of my week in another practice. And that had advantages and disadvantages. The disadvantages are, you're part-time at two different places. So you're not getting full-time benefits anywhere. But the advantage was I got to see how different people run their practices.
That's a bingo moment for our audience. Awesome.
Yeah, and dentistry is weird. All dentists do things differently. You'll never get the exact same opinion from two dentists, and I've always found that strange.
Do you mean that with regard to patient care or business operations, or both?
Both. From the perspective of a dentist, when I was starting out, particularly with patient care and clinical decisions, everyone does things differently, and two dentists might see the same situation and have two completely different plans for it. And so I got that exposure to the way different dentists look at different situations. And like you said, I also got the exposure to the way different people ran their practices. And the two practices that I started out at couldn't have been in more stark contrast to each other. One of them was cool because it had previously been owned by this guy that I would have considered one of my mentors while I was in school. And so this woman had bought his practice, and she was younger and really trying to grow it. And in my opinion, was doing a pretty good job of growing it. She had added one or two more hygienists to the schedule per day, and I think had added another associate dentist to the schedule per day, which in terms of the size of a dental practice, you measure it by number of active patients and number of patients that are being seen on a daily basis. And so to have the capacity to add, two or three more clinicians on a daily basis, then that's significant growth. And she had accomplished that. And I got to watch, just like the policies and procedures they had in place for how they handled patients and how they handled staff. And I can say that I really respected the way they did things. And I took a lot away from that. And the other place that I was working at the same time, like I said, couldn't have been any different. It was this woman owned the practice, but she didn't do any dentistry. Not because she was physically unable or anything. I think she just didn't want to. But she also, she was never there. She was never there when I was there. So there was no management. There was no leadership going on at this place. And it was just it was weird because I had to make a lot of decisions and take stances on things that I felt I shouldn't have necessarily had to as an employee. And so I got to see a lot about the way I don't want to run a practice when I was working there.
That's valuable, if not more, I think.
Yeah, absolutely. And so, like I said, I thought that was cool, and that was the reason I wanted to work part-time in a couple different places, was so that I could gain different perspectives, but also if one of those jobs was just really going poorly, then I'd be able to leave and look for another part-time job while still having a place to go a few days a week. So I think that I gained some good experience doing that. And then the practice that I own now, it was kind of good luck. I just kind of fell into this job, and it was just a really good job to have as an employee. I was set up well there. I had a lot of autonomy, and it was I just liked. I felt really comfortable there. I guess is just the best way to describe it. And then the opportunity for ownership came up. The guy that hired me was, at retirement age and was already thinking about retiring anyway, and sat down with me at one point and said, look, I'm not going to be around here a whole lot longer. And I want to sell this place. He was like, my main concern is just that this practice continues after I'm gone. Basically, he was just concerned with like legacy, I guess is the best way to put it. And the practice had been, he's owned it, or he had owned it since like the early 80s. And prior to that, his uncle owned it. And so this place has been around since like the 60s at least. And so he wanted it to still be, a dental office in this community and to continue on. And so he gave me a really good deal as far as what the whole contract looked like in buying it. And so I just pursued it, and here I am. I ended up as the owner.
Congratulations.
Thank you.
And I know you pretty well. And I think, and my mom was a dentist. So I think I'm not the normal listener who, because I think the average human hates dentists for whatever reason, right? And maybe you have some insight into that for us. But I think, business aside, anyone listening with a mouth, right, and teeth, this is important because, Dr. Mike here is another person, right? And he chose a profession, and it's part of your health. It's part of your ecosystem. So I know I have a different interpretation because I grew up with getting my teeth worked on all the time. So it was never a thing that I developed as a fear, right? And my mom was dentist, so it was never weird. But I know most people really abhor coming to see you, right? So thank you for sharing that with us. I'm going to pass the baton to the other Mike, and I'm sure I have a thing more or two to say, but this has been interesting. I've learned a lot, despite having a mom as a dentist and knowing you, about the curve and process. So thanks.
So Mike, before we transition into this next segment, I always like to ask our guests, what is the best way for people to reach your organization? Website, phone number, email? What do you put out there if new patients want to come on board with you? Understanding that you are in the Glen Burnie, Severna Park, Maryland area. Now, granted, if somebody wants to drive down from Jersey and get their teeth cleaned by you, why not? But we're talking about largely Anne Arundel County and parts of Baltimore County, right?
Yes. So the best way is just the phone number. The best way is just to give us a call. But you could also find our website, magothydental.com.
Okay.
There's an option to email on there, and I believe it's frontdesk@magothydental.com. But
okay,
if you are someone who's interested in making an appointment or coming in to see us, then the best way is just the phone number, which is 410-255-1050.
Awesome. And you brought up a couple of great things in that first segment that I think lead into my leadership questions.
Mm-hmm.
You could take 10 dentists, show them the same set of teeth, and you'll get 10 different answers.
Mm-hmm.
And I think that's because at the core, dentists are people too. And you could even take 10 dentists that had the same curriculum at the same school, and you'd probably get 10 different answers because people have different perspectives. And Alison and I were talking about this in the first segment, that you have different perspectives. Your path, that thought of being a vet when you were in high school, and then ultimately, I'm going to study biology. And then, okay, well, why don't I become a dentist? The next dentist in your very own practice may have known from the time they were 6, I'm going to be a dentist. And that impacts how you perceive the world. So I love that you brought that out, that was a big piece. And it sounds like the ownership of this practice wasn't necessarily in your view, but you saw a tremendous opportunity and you saw, well, this is a good path for my profession to take. Am I getting that right?
Yeah. I think I always knew, like, once I had made the decision to be a dentist, I always knew that at some point ownership was something that I wanted. It's one of it's one of the few jobs in healthcare where that is like a very reasonable end goal.
Mm-hmm.
And it's one of the, honestly, one of the really appealing things about going into dentistry is you can own your own business, and it's not, I don't want to say it's easy to do, but it's not, you don't necessarily have like a really difficult road ahead of you on the path to ownership.
Yeah, and the other thing that you said that really stood out to me is before you settled on one practice, you went and worked part-time at two different practices. And Alison and I talk about this all the time. We've seen a lot of the wrong ways to sell.
Mhm.
We've seen a lot of bad salespeople. We've seen companies that do things to their employees are like, that's not right. That's not how you run a business. And I love that the first one that you mentioned, what you appreciated was the desire for growth. And it sounds to me like they did it the right way.
Mhm.
And then on the other end of that, the other dentist was literally collecting a paycheck.
Right.
This is my business. You guys do what I say. I don't care if you're happy or not. Go find another job if you don't like it. I mean, that's the vibe that I was picking up from that. And it's terrible, but there are just as many of both companies out there in the world. So an interesting dynamic. I'm going to speak from my own perspective, and I really want to get yours.
Sure.
Most medical practices, whether they're dental or, traditional healthcare, or like the doctor or doctors are often peripherally involved in the day-to-day operation of the business. And you tend to lean heavily on an administrator to take care of the tactical aspect of running the business every day. So I'm very curious to hear how you've managed that. What's that experience been like from a leadership perspective?
Sure. So I would say that, it's been just over a year since I took this place over. And in that amount of time, what you're describing has probably been my greatest challenge. And that's
And
because
everyone's, by the way, so don't feel alone in that statement.
so I took, when I took over this place, there was an employee who held the title of office manager, but but she also had been there for a long time and was looking at retirement, and the practice needed some management help. And so once, it was clear, she told me that she wanted to kind of phase out and retire.
Well, at least she was kind enough to tell you that. A lot of times they don't.
Yeah. And so it was, which was good, because I would have ended up needing to do something about it anyway. But I knew I needed a good office manager, because it was, as a dentist who also owns the business, there's many things happening, but
Sure.
my primary responsibility and my primary job is patient care. And so I need to be in the back, in the treatment rooms, treating patients. And because ultimately that's how the business generates income. And I'm the only one, aside from the hygienist that works for me, I'm the only one that's capable of doing that. So my primary focus needs to be there. So I can't be too concerned about, or I don't have the time to deal with everything that's happening in the front of the office. And so I need someone who is capable up there. And so I tried to, I tried and failed at least once. I hired someone hoping to kind of groom them into this position, and it didn't work out. And then more recently, I hired someone who had some considerable experience as an office manager. And brought her in, and she's been managing that aspect of things, and it's been a world of difference having someone good who is capable in that position to be able to handle all that stuff and can come to me, when there is a big issue, or come to me at the end of the day and say, like, these are the things I took care of today. I just need your opinion or permission to do these next few things that we have to do. So, I mean, having a good manager, having someone I can count on to take care of one aspect of the business while I take care of another has been tremendous.
Yeah, I think we can summarize what you just said into one word, which is trust. When you have a staff that you can trust to do their job, and maybe sometimes they make mistakes and you go, oh, why'd you do that? But overall, that, hey, I've put the right people in place to run that aspect of the business so that I can do what I'm best at. I think that's, and that you failed, because, most business owners are afraid to admit that they've failed. I think that's the healthiest thing about what you just described. Putting the right people in place, trusting them, and then being willing to fail, because that's how your business is going to grow and it's going to thrive, right?
Right. I mean, and that's, sometimes it can be paralyzing having to make big decisions like that because you don't want to fail. But at the end of the day, like, you're going to fail. Like, there's
everybody fails.
There's no way around it. And so you just have to be ready to accept those things when they happen and make another decision and move forward.
Yeah, I think what most people miss about that is there's big failures. You want to avoid big failures.
Right.
But we make mistakes as human beings. We are incredibly fallible. We are incredibly flawed. And you got to be okay with that. You've got to be okay in your own skin. So I love that. And by the way, worst time in the world. Hey, it's COVID. Why don't I buy a business? What are your parting thoughts on that, Dr. Mike?
Yeah, I mean, that was obviously, I'm in hindsight, I might have to do things a little bit differently, but I mean, it's a global pandemic that no one could have predicted it. There's no way of knowing when something like that is going to happen. So, like, right after the pandemic really hit in full force, a lot of people asked me, like, do you regret buying the practice? I'd say, like, no. I mean, I don't regret it. Like, it was a good decision at the time based on the current circumstances. No one could have predicted this or seen this coming. And I kind of kept telling people, like, I figure if I can make it through this, then
you are battle tested. Yeah.
Then the rest of my career is just going to be cake. So it was a nice trial by fire, so to speak. But I mean, it was, a lot of it's just out of your hands. We, in the beginning, so I didn't choose to change a whole lot about what was happening in the business in the beginning, but in short order, the authorities and the health department told dental practices that you can only see people on an emergency basis. And so, it also wasn't clear, like, what kind of assistance was going to be available to people that were out of a job because of stuff like this at the time. And so my primary concern was being able to generate some kind of income and pay my staff something, because at in the very beginning, it wasn't like, hey, everyone just, like, you can sign up for unemployment and you're going to be taken care of and it'll be fine. It was like a lot of people were having difficulty getting unemployment. A lot of things were not very clear early on. And so I wanted to make sure that the staff was taken care of. So, we couldn't fill a schedule with patients because you can only see people on an emergency basis. So I was just showing up to work every day hoping that somebody out there had a toothache. and it was, I mean, it was good for me to still be able to go into work when everything was going on and there was so much uncertainty. It was good to have that, like, still little bit of routine. Yeah, but I don't know what else to say about it. It was just a really weird, really uncertain time. I'm glad it's over. I'm glad that all of that uncertainty is over, and at least we've kind of adapted to the way things are. And at least in my business, we're able to still do business.
Well, Dr. Mike, Magothy Dental, I'm going to summarize what you just said in one word, which is humanity. And I think that's the key to your leadership. And we're exceptionally grateful that you were on the show today. So thank you. Alison, your parting
Thank you
thoughts
for having me.
wrap up.
Yeah, this was fun. I'm like geeking out a little bit over here. I appreciate you sitting with us this morning. And Mike thought of trust and I thought of efficiency, right? So to the business owner out there who has their hands in all the pots, it is impossible to do your job best with your hands in all the pots. So I know it can be, like you said, paralyzing to delegate and take the leap of trusting someone that you don't know yet. And I think failure can be just, interpreted in different ways. I think you made a choice and it didn't work out, right? So great. Now you move on to the next opportunity. You have all that much more experience to handle the next thing. So you were awesome this morning. Thanks for your time. And the other Mike, it's always
Well, everyone, again, thank you for listening to Mike and Alison After Hours with our special guest, Dr. Mike, the owner of Magothy Dental. And for Alison Haas, I am Mike Sheila. And remember, folks, people helping people. It's powerful stuff. Have a great day.
Thank you for joining Mike and Alison After Hours. Tune in next time for another great business owner sharing valuable industry ideas. Want to be a guest on our show? Contact us at answers@getadvantage.com.